We loved the buzz, but then a hush came over the crowd. Good morning, beautiful people. You look marvelous. We are thankful that you are here. We're excited about having our states represented and the great work that you did last evening in your state meetings. And we want to welcome you to CADCA's 22nd Leadership Forum. Collaborate, advocate, and innovate. It is indeed a pleasure to have you all have journeyed from far and near to be here to experience this occasion with us. And right now, it gives me great excitement to introduce our first presenter. Our first speaker this morning, of course, is our esteemed leader, General Arthur T. Dean. You know, before joining CADCA, our chairman and CEO, General Dean, served in the Army for more than 3 decades. And during his time in the Army, General Dean served around the world, and he saw combat and was esteemed in the results that he was able to achieve. So, no task for him to come and lead an army of preventionists and treatment and recovery experts who are making a difference, just like the men and women he led over 3 decades of service to our military. When he retired, he thought that there were some additional issues that were important for him to address. And so, the very first day he retired, he then came to work for CADCA, and we are blessed to have had him as our leader since 1998. He's led us in all of our efforts against drug and alcohol abuse, and to make sure that prevention is first and foremost and recognized in the field. He's provided strategic direction, diversified and increased funding for coalitions around the nation, and oversaw important work internationally as well. And of course, the CADCA staff is pleased to have him as our general every day. Please join me in welcoming the chairman and CEO of Community Anti-Drug Coalitions of America, General Arthur T. Dean.
Well, good morning. Thanks to Karima, one of our great leaders at CADCA, that I was fortunate enough to recruit out of the great city of Atlanta, Georgia. Well, I have my task this morning is to give you a summary of our State of the Union in about 10 or 12 minutes, because we have some very important speakers that we want you to hear from and interact with. So that's what I'm going to attempt to do this morning. But I want to say again, as I've said to you in different audiences, welcome to our 22nd annual conference. That in itself is an accomplishment. So thank you very much. Welcome. You know, it wasn't an easy task for you to be here, and we understand that. We fully realize the impact that our recession and the recovery from our recession is having on you. But I want to thank you for being here, and some people traveled great distances to be in this room today. We have people here from Guam and the Hawaiian Islands, from the Marshall Islands, and we have a young woman with us all the way from the country of South Africa. Ms. Swenwego is here from South Africa. So we have people from around the world here. We're excited about that. So I'm here to say to you this morning that in spite of and in face of our significant recession, the very difficult political environment that we find ourselves in today, that our coalition movement is strong and continues to grow. So thanks to you. The number one reason the number one reason for our viability is this simple fact. Coalitions work, and we know that. And you are demonstrating it every day out in your communities. You've heard this before, but it's worth repeating that there was a recent survey, a research survey that says that evaluated our drug-free communities program and found that the evaluation of middle school youth living in drug-free communities, where those communities have been funded by the Drug-Free Community Act, found a 12% reduction in alcohol use, 28% reduction in tobacco use, and a 24% reduction in marijuana use. Congratulations, and thank you so much for your great work. There's also further research that talks about our high school-aged young people, and it demonstrates and says that in those communities as well, we look at high school students across the board, you're looking at an 8% reduction in alcohol, 17% in tobacco, and 11% in marijuana. So you are doing magnificent work, and because of your effectiveness, this movement continues to grow and continues to be strong. Our training infrastructure has never been better. CADCA's National Coalition Institute, in partnership with the Office of National Drug Control Policy, and of course our friends at SAMHSA, the Substance Abuse and Mental Health Services Administration, provides coalitions with a foundation of training and technical assistance that is evidence-based and is practical and research-based and is being effective. We are transforming communities, and we are doing it in spite of the difficulties that we face out in communities. Just this year alone, we've had over 150 coalitions graduate from the National Coalition Academy, and that's a year-long commitment at least 2 members have made from those communities. Tomorrow evening here, 119 of those coalitions will be here to receive their certificates. So we're excited about their graduation. Congratulations. So this is a collaboration that simply would not be possible, though, and the results I just cited to you, if it was not for our great friends at the National Guard Bureau. They are our heroes, and because of them and their support in their counter-drug training centers around the United States, this is made possible. So thank you, National Guard. Thank you. Our director of the National Coalition Institute is here, Jane Callahan, and I'm singling Jane out because she has convinced me over the years to use some language that she started a few years back. And I'm going to attempt to do that this morning. And Jane would say, if she was given this presentation, that CADCA is making coalitions smarter, faster. And that's really what it's all about. We don't have any time or any years to waste. We've got to move and move quickly. Michigan State University did some research, and they do a research evaluation of the Institute yearly. And their most recent research says there's evidence based on an independent evaluation by Michigan State University that when coalitions are trained by our institute, that we can begin to see environmental and other changes taking place in their communities in as early as 6 months and with great clarity at 12 months. So that is a big change, because you remember a few years ago, we thought it took 3, 4, 5 years to have an impact. That is not the case anymore, and we're excited about that. So coalitions are effective, they're well-trained, they're advocates, and they are more organized and laser-focused, and we're excited about that. So as you walk the halls, I should say, of Capitol Hill, and when you're visiting around, we want you to carry that message and carry that message loudly. Last night, I tried to get to as many of your state meetings as I possibly could. I hope that you enjoyed those. The excitement and the passion that I saw was phenomenal, and we hope that those help you prepare for your upcoming visits to Capitol Hill, because you are the advocates. You are. We may represent you in Washington, but because of you and our representation, if you go back and look at the history and look at what would have been cut or what has been restored, you, combined with us, has been able to cause $2.88 billion to be saved and not cut from this field. So congratulations to you. So this effectiveness is really catching fire and is going around the world. It has really gone global, this coalition strategy. And you'll hear more about that this morning when the director of the Office of the United Nations Office on Drug and Crime is presented to you in the form of a video. But we're very proud of our international work. We're very proud of the impact that we're having. We're excited about being in 10 countries around the world, carrying this strategy and building coalitions with the help of the U.S. State Department, because without their support, this would not be happening. So we are very, very pleased and thankful for that. So back at home, CADCA is increasing its support to our military veterans, something that we care dearly about, and that's why we launched what we call Vet Corps. They're in training. They're in here this morning, but they're in training this week. And the goal is to use our coalition infrastructure to add a VISTA or AmeriCorps VISTA member in coalitions. We're still recruiting coalitions to do this. We hope to have 100 sites filled by the end of the year. And that coalition will, with the help of their Vet Corps person, hopefully will be a former military member, provide services and help orchestrate the needed services for veterans and their families when they return to your communities. So a project that we are very, very excited about, and we're looking forward to its impact it's going to have in communities all across this country. At our big luncheon on Thursday, we're going to swear in a few of the members so that you can see it in action, and we will move forward, and this is going to be terrific. We're also exploring and doing a lot of work lately in the area of tobacco. We looked at our annual survey, and we found that 59% of you say you do direct work in the area of tobacco. And we are one of four national organizations that have received a CDC grant to do community transformation work around tobacco. We're doing that with our partners from the Robert Wood Johnson Foundation and our partners out at the University of San Francisco, Mr. Steve Schroeder and his organization on smoking cessation. So you will hear more from us as we continue to do this great work in the area of tobacco, and we are very excited about that. Our emphasis on engaging young people in all facets of our work could not be more important. While we started a few years back, and we now have the great support of the Office of National Drug Control Policy in implementing our National Youth Leadership Initiative, it has grown. We have nearly 300 young people in training this week alone. We have taken it to the full state of West Virginia. We do one annually at our mid-year. We have gone to other locations as well. But we cannot be more concerned about the development and growth of our future leaders. Also, while we have the program called the Ambassadors Program, we are selecting our third cohort of young leaders in the field already and putting them through a 2-year fellowship to enhance their skills, and hopefully they will continue to be a part of this movement in years to come. Next year, we're going to be having another NYLI when we go to Nashville, Tennessee for our mid-year. We're going to be out in Nashville. We're excited about that. You're going to hear from Dr. Jane Fowler this morning. He's going to be talking to you a little bit later, and he's going to talk particularly about the importance of social media, how one can stay connected. And we at CADCA have ways for you to stay connected. You know, we have our connected communities. There are sites on our connected communities in 3 different languages. So we want you to follow us not only on connected communities, but on our Facebook, on our Twitter, YouTube, you name it. It's important for us to stay connected. And they even have this old guy blogging as he travels around the world, attempting to stay connected and make sure that you're aware of what is going on. You know, it's important that we at CADCA be known as change agents, and that you, this movement, be known as change agents, because you really are. You're not only changing the U.S. now, but you're literally changing the world. And it's important that you do that. And, you know, and every day we have to push back. And Mr. Tucker is here going to talk to you this morning from the Office of National Drug Control Policy. And I wanted to quote the director, Mr. Gil Kolakowski, because Gil has said, and I quote, he says that, let me get my folk here, that smoked marijuana is not approved by the FDA and is not medicine. Science shows that it is addictive. Research shows it impairs driving. Studies show that it, in fact, degrades academic performance. And Director Gil Kolakowski is absolutely correct. And I wanted to make sure that we understood and know how he feels about this very difficult situation that we're facing out in our communities. So you are, in fact, changing America. You are, in fact, changing the world. And you are our front lines that are going to help us push back against things like medical marijuana. Thank you so much for doing that. Now, you've been the first to impact designer drug issues like spice and bath salts. You've been the first to help work with poison control issues and things around that. We hear from you all the time when there's an article or something on TV that is not appropriate, and we want you to continue to do that because we want to make sure our voice is collectively heard. In 1997, Apple visionary leader Steve Jobs ordered the creation of an advertisement campaign. It reflected a philosophy that he wanted to have reinforced within his company. Then, this is the same company, that he led and created. Later, he was, in fact, released from that company. It began to struggle, and they asked him to come back. And the campaign that Mr. Jobs had created was called Think Different. And it remains one of the most effective and memorable campaigns ever. It's important that we understand the importance of thinking in a different way. People like Einstein, Gandhi, and many others have always said the people who are crazy enough to think that they can change the world, in fact, might be the ones to change the world. And that's really what this movement is about. You having the foresight and the ability to know that you're capable of changing the world, you're willing to think differently, and you are willing to do it one community at a time, one state at a time, and to take it globally. I can think of no better place than to have this movement impact us around the world. I want to thank you for your CADCA membership. I want to thank you for your commitment to the great work that we're doing. I wish you Godspeed, not only here at this conference, but throughout your work. And may this movement continue to grow and continue to have a global impact because of you and your great leadership. We thank you very much. Thanks.
I was taking a quick little break. I'm back now, though. General Dean is moving. He wants to make sure you get to those workshops right away. So let me follow suit. We are very thrilled to have with us today the Deputy Director for State, Local, and Tribal Affairs from the White House Office of National Drug Control Policy, Mr. Benjamin Tucker. Mr. Tucker oversees ONDCP's High-Intensity Drug Trafficking Areas Program. Most of you may have know of it as HIDA, the Drug-Free Communities Program, DFC, alphabet soup for 1,000, and the National Youth Anti-Drug Media Campaign, as well as the Counter-Drug Technology Assessment Center. Quite a busy docket. With 40 years of experience in the fields of law enforcement and criminal justice, Mr. Tucker is a recognized expert in community policing. Prior to joining ONDCP, Mr. Tucker served as a professor of criminal justice at Pace University. He began his career with the New York City Police Department in 1969, and prior to being assigned as a beat cop, was one of a selected group of new precinct service officers educated by medical and other substance abuse experts to conduct innovative drug prevention and education programs in city schools and colleges. He is well equipped and well prepared for the great work he's doing as the Deputy Director at ONDCP. Join me in welcoming Mr. Benjamin Tucker.
Good morning, everyone. How y'all doing? How y'all doing? Yeah. Okay. So, these folks up front with me, Jack and Shannon, making fun of the fact. See, when they talk about 40 years experience, they start counting and figuring out how old they were when I joined the New York City Police Department. It's really pitiful. They need to pick on somebody else. So it's really good to be here. Thank Karima and thanks to General Dean and his team. It is always a pleasure to be involved in any of the engagements that bring all of you to us so that we can sort of work on the business of building coalitions in a way that make them effective, and also dealing with the problem of drugs and drug addiction and its impact in all the ways that we know can be challenging. Just before I start my remarks and spend some time with you, wanted to just mention that I was yesterday, just about less than 24 hours ago, I was in New York City to participate on a panel at the Guggenheim Symposium at John Jay College of Criminal Justice, and the topic was America's addiction, and it was a panel with some folks from the Schomburg Center in Harlem and the head of the Probation and Parole Association, as well as the director, the special prosecutor for New York City's special prosecutor that deals with all the drug problems over there up in New York. And we had an opportunity to sort of make presentations and then have Q&A and have discussion about how we look at some of the challenges we face in this country around drugs, drug policy, drug enforcement, and dealing with the drug problem from a public health perspective. And I had the opportunity always, as I always do, to talk about, as we think about innovative solutions to the problem and how we approach it, and we talk a lot about those innovations, I always make sure that I talk about coalitions. So I had the opportunity to talk about the importance of DFC, and to make it clear that DFCs are, when we talk about anything in this country that has to do with the challenges we face around drugs and drug policy, coalitions are really where it's at. I mean, it's local. I mean, it's about you folks solve the problems, you identify the problems, you identify the threats. It's about doing business at the local level and taking care of business at the local level. And that's something that you do so well. And I will repeat that several times during my remarks this morning. But I wanted you to know that whenever I get an opportunity and all the travel that I make around the country, whenever I have the opportunity, I'm always ready and to mention the importance of the work that you do through coalitions. In his State of the Union address, the President laid out a blueprint for an America built to last. His vision was founded on American manufacturing, American energy, skills for American workers, and a renewal of American values. And his vision requires that we, all of us in this room, work together to create stronger communities and healthier individuals. I mean, that's really sort of the mission we have. And while that was the mission before 3 years ago, it is very much a mission in this presidency, and President Obama focuses on that mission in important ways. We know that drug use strains our economic, health care, and criminal justice systems and endangers the futures of our young people. And so simply put, our nation can't reach its full potential without a drug-free and healthy generation of young people. You are our future. And while we have made progress in the past 3 years, in large part to your work, due to your work within your communities, recent data is sobering, and it indicates that there is still much work to be done. A recent study by the Department of Justice estimates that illicit drug use in America contributes to $193 billion with a B, billion dollars in crime, health, and lost productivity costs in 2007. So to put that in perspective, there's not 3,000 of us in here, but if there were 3,000 of us in here, each of us, if we had to pay to cover that $193 billion cost, would have to pay $176,000 a day for the next 365 days this year. To give you a sense of the magnitude of the money that we could be using in much more effective ways, but it's a cost that we currently bear. So how do we get here? According to the Monitoring for the Future study, youth drug use rates have risen significantly in recent years. Among 10th graders, past month use of any illicit drug increased from 15.8% to 19.2% over a 3-year period from 2008 to 2011. And past month use of any illicit drug among 12th grade graders increased from 21.5% in 2006 to 25.2% in 2011. Obviously, those numbers run counter to the data that General Dean cited, and I think underscores what my point about how important coalitions are, because the data, even as the numbers are going up generally around the country, in communities where DFC coalitions are operating, the numbers are clearly, as it relates to our high school students in particular, going the opposite direction. Really important. So we've got a challenge still. Drug driving continues to pose a significant threat to our roadways. Data show that among deceased drivers who were tested and for whom results are available and reported, 1 in 3 tested positive for any illegal drug or for an illegal drug in their system. And this is especially troubling with regard to our young people, where roughly 1 in 4 fatally injured drivers who tested positive for drugs were between the ages of 15 and 24. Real challenge. Moreover, approximately 1 in 8 of our high school seniors reported in 2011 that the 2 weeks prior to their survey interview regarding the study, that they had driven right after smoking marijuana. So it just confirms what a challenge we have. Making matters worse, prescription drug abuse continues to be a problem and claim American lives, with data from the Centers for Disease Control and Prevention showing that nearly 28,000 Americans died in 2007 from unintentional drug overdoses, driven in large part by prescription drug medications. And during this morning's opening plenary, 4 Americans will die from an overdose. Give you some sobering facts, and that's just what we face every day. In fact, as a result of the increase in prescription drug abuse, for the first time, drug-induced deaths are the leading cause of unintentional injury death in America. Among the first-time drug users, 1 in 4 began using a prescription drug non-medically, and 6 of the top 10 substances used by high school seniors are prescription drugs. So it gives you a sense of this problem we have with prescription drugs and it being an epidemic. So that's kind of the platform. That's kind of where we are. So how should we respond? I mean, you know some of the answers to how we respond. You've been doing it every day, but it bears, I think, repeating. If the key is to building a strong and healthy America, lies in its people and their communities, then your work and your success is more critical than ever. So it means you can't slow down. Even with the milestones you've met, we still need you to keep pulling, keep pushing, keep learning, and keep doing what you do at the local level. The President's inaugural National Drug Control Strategy, published in 2010, represented a new direction in our efforts to reduce illicit drug use and its consequences in this country. An approach shaped by the recognition that drug addiction is a disease. It's not a criminal problem. While it is a problem for our criminal justice system, it's very much a disease. We have to look at it as such. And as with any disease, a public health approach that focuses on prevention, in the case of drugs, preventing use before it starts, saves both lives and money. So to that end, the administration's commitment to reducing demand for drugs is backed by significant resources. This last fiscal year, we spent $10.4 billion on drug prevention and treatment programs, compared with just over $9 billion that we used and spent on domestic law enforcement. During the past 3 years, the Obama administration has committed over $31 billion to drug prevention programs and support for expanding access to treatment for people with substance use disorders. So prevention is an essential component of this public health approach and has become one of the highest national drug policy priorities for the Obama administration. We know prevention works. Research has shown that each dollar invested in an evidence-based school prevention program can reduce costs related to substance use disorders by $18, as much as $18. And now a topic near and dear to my heart. Over the past 12 years, millions of young people and their families have relied on the National Youth Anti-Drug Media Campaign for vital information to protect themselves and their loved ones from the serious health and safety consequences of drug use. Unfortunately, President Obama's $45 million request for vital prevention program was rejected by Congress, despite evidence showing the campaign to be effective, relevant to young people, and instrumental in supporting drug prevention efforts in communities across the country. And while this lack of funding threatens to derail our national campaign, as well as our promising community-based approach program that we put into place 18 months ago to engage young people actively at the local level, many of you in this room today have participated in media campaign activities and are deploying media campaign tools in your community, and I encourage you to continue to do so. Clearly, the timing for the cut couldn't be worse at a time when surveys, as we've already indicated, show that young people perceive drug use as less risky, and parents rate drug use as among the top health concerns that they have. So we're committed to finding ways to continue the Above the Influence campaign as we transition out to make sure and ensure that you continue to use the assets through the toolkits and the other information that we've been making available. We'll figure it out, figure out how to keep that going, certainly in the short term, but hopefully in the long term. Additionally, we will continue to leverage our relationships with you, the private sector and other youth-serving organizations like the Boys and Girls Club, SAD, chapters, and others. And of course, the administration continues to support strongly what has become the prevention cornerstone of our national drug control strategy, the Drug-Free Communities Support Program. So as I said before, you guys are essential to the President's new approach and continue to be an asset. As you know so well, effective drug use prevention happens locally, as I indicated earlier, and requires cooperation across the community with peer leaders in schools and law enforcement, as well as healthcare providers, faith communities, and neighborhood coalitions generally. The Drug-Free Communities program is one of the best examples of this concept in action, and its effectiveness is well documented. A national evaluation of the Drug-Free Community Support Program released at this conference last year found that youth substance use, as I mentioned, has declined significantly, and that's a good thing. In August of 2011, the administration announced $12.3 million in new DFC support program grants to 87 communities and 20 new DFC mentoring grants, in addition to nearly $76 million in continuation grants for 607 of our currently funded DFC coalitions and 12 DFC mentoring coalitions. And we look forward to continuing our work with community coalitions across the country, and I promise you we will continue to do that. So your work encourages young people in our nation to be involved in their community, to be active in making our nation a better place, and to choose each day to live drug-free above the influence. And so we must continue to normalize this behavior. It's very critical. We've got to keep our young people in that mode, to celebrate the successes of our young people, and to hold them up as models for their peers. So one young person leading by example is someone I'd like to mention and introduce you to right now. He is CADCA's Youth of the Year. His name is Teddy McCullough. And Teddy's got this resume. Let me just read this to you. This is pretty cool. He's the founder of the San Juan County Youth Council, co-founder of the Lopez Island Prevention Coalition. He's worked to reduce alcohol density in his community. He's testified before policymakers and courageously led youth and adults alike in making his community safer for his peers. Teddy's blushing. I'm not done. He's also a freshman this year at American University here in D.C., and I'm happy to say and proud to say that he's also he's our newest intern at the Office of National Drug Control Policy, which is Jack and Shannon, when Teddy started, they were in tears, in part because they liked Teddy and wanted him on board, but really because they needed some help. So Teddy is he's a terrific young man, and we are we are proud. So in addition to Teddy, we have in this room this morning, I think something like 300 youth from across the nation joining us to participate. So we've got these other folks in the room, and many of them are part of National Youth Leadership, the National Youth Leadership Initiative that General Dean referenced earlier, that ONDCP supports. So let me ask all of these outstanding young people to stand, please, and let us recognize them. Very cool. Now, General Dean also referenced Vet Corps and I just want to take a minute to just mention that. We also look forward to CADCA's work with the National Guard Bureau, who is also an important, as General Dean pointed out, ally to the work that we do. They support not only our coalition building work, but they also support our HIDAs incredibly well with the intelligence support for our domestic law enforcement platform. And so the National Guard is if we didn't have them, we'd be in serious trouble. So General Dean mentioned that the Vet Corps program seeks to provide access to health care with an emphasis on substance abuse prevention and treatment and housing and employment to veterans and military families. Really critical, particularly at this time. And the results achieved by these programs and our ongoing commitment to them can help reduce our nation's drug problems with a sense of confidence and purpose. As I noted earlier, youth drug use has risen significantly during the past 5 years, and an increase driven largely by what was mentioned earlier, by increasing use of marijuana by our young people. This increase in marijuana use is also connected to one of the most troubling findings in this year's Monitoring the Future study, synthetic marijuana, known as SPICE or K2, which ranks as the second most frequently used illicit substance after marijuana among our high school seniors. The Monitoring the Future data also indicate fewer teens see much danger associated with marijuana's use, even with regular use. Disapproval of marijuana use among teens closely linked to their perception of risk has fallen during the past several years. Research has also shown that such changes in perceived risk and peer norms often foreshadow increases in youth. None of that is good news. I think it's important to point out that one possible influence of this observed trend in drug use perception of risk is the presence of messages and policies that minimize the consequences of drug use. Misleading messages may influence young people's attitudes regarding marijuana use. Advocates, for example, of so-called medical marijuana extol the virtues of the substance that has never been found to be, by the FDA administration, to be either safe or effective medicine for any condition. Safe alternatives have been developed in the form of orally administered drugs derived from the components of marijuana, the marijuana plant, and there are a couple of those on the market right now. And those who pursue the goal of outright marijuana legalization argue that legalization will solve a wide range of social problems, from reducing violent organized crime to helping solve state budget shortfalls. So far, the American public has received these arguments, I think, with appropriate skepticism. Marijuana use, as was pointed out earlier, is harmful. The analyses suggest that under legalization, marijuana use would increase the cost to society, would greatly grow and outweigh any potential tax revenues, which has been a strong argument by pro-legalizers, and transnational criminal organizations would continue to operate. They just, marijuana is not the sole drug that they're engaged in using. And so, in fact, there's some studies that suggest that if they were legalized, it may still drive the underground market. So in light of the troubling trends in the youth use of marijuana and perception of risk, I ask you to help young people to get the facts. And smoke marijuana is not safe, it's not medicine, and it's not legal under federal law. Now, a number of you have reached out to ONDCP in recent months looking for help to counter misinformation with respect to marijuana and looking for information supported by science. And so to counter half-truths with the real truth and to give voice to young people and the community efforts to reduce marijuana use in your communities. In response, ONDCP is launching for the first phase of an effort designed to provide you with the science and data necessary to inform and mobilize your communities against the harms created by youth marijuana use. So I'm announcing this morning that we are posting online as of this morning a marijuana resource center that provides you with the latest research and public information materials on issues related to marijuana. So frequently asked questions, we'll ask and answer those. We'll provide information on federal laws. We'll provide information on state laws as well. I want to ask our technicians if they might, put the website for the Resource Center up on the board. It's www.whitehouse.gov.ondcp/ONDCP/marijuana.info. And so if we can get it up there. Where's it at? Got it. Okay. Thank you. So we hope to take. We hope you will take the time to visit the site, check it out, and see whether the materials there serve your needs. And if they don't, then we would ask that you let us know what else you might need, and we'll make arrangements to make sure that information is placed on the site. In addition to the science and the data you need, we have posted, as I said, frequently asked questions, and in weeks ahead we will continue to add tools to build the site to help in your efforts. In closing, thank you for the work that you do every day, each and every day. I mean, it really is incredible. I feel the energy. I'm privileged when I travel to get out of the office in D.C. and get around to a number of your communities and participate in activities, many of which are sponsored by not just the DFCs, but in partnership with our media campaign efforts at the community level, as well as our HIDAs in some cases. And so those partnerships are vital, and we want to make sure that those partnerships continue as much as we possibly can. We also know you are making a difference in ways that matter, and we continue to make sure that folks are aware of that. Data show it, and the voices of youth attending this conference confirm the importance of the work that we do collectively. So on behalf of Director Kerlikowske and the entire ONDCP team, Jack, certainly, and Shannon, as well as some other staff are in the office here, in the room here, Cynthia Caparizzo, who's my senior policy analyst on criminal justice matters, as well as Mary Highland, who's my staff director, are here as well. They all, the reason that we're able to support you in the way that we do is due in large part to those folks that I just mentioned, and a number of others. So thank you for having me, and we're honored to support the great work that you do. I also look forward to seeing, I think, you later in the week when we do our power session, I think on Thursday, and I'll be with my other two colleagues, Deputy Directors Quagliati and David Mineta. So listen, see you in a few days, and I think I'll see the young people a little later this afternoon. So thanks very much.
Thank you so much, Mr. Tucker. And as the Vice President for Development and Youth Programs at CADCA, I'd particularly like to thank ONDCP for their public, their private, and their financial support of our youth programs, and specifically the National Youth Leadership Initiative. Well, I'm sure that you're aware that drug and alcohol abuse affects more countries than just our own. Earlier, General Dean shared and spoke to you about our impact globally. In addition to CADCA's work building community coalitions overseas with the Department of State, we have also been sharing our comprehensive multi-sector approach to community-based prevention with the United Nations Office on Crimes and Drugs, UNODC. In fact, CADCA is one of only 2 U.S.-based non-government organizations that have consultative status with the United Nations and is a member of the Vienna NGO Committee. CADCA has participated in multiple discussions and has presented to the UN delegates about the effectiveness of the work that you do, the effectiveness of community coalitions, and your impact on substance abuse issues, your impact on reducing drug driving. And these presentations have occurred in Vienna, Austria. The UNODC's Executive Director, Mr. Yuri Fedotov, has prepared a special video message for you. And Mr. Fedotov is a highly regarded expert and is considered the world's drug czar. Although Mr. Fedotov could not be with us this week, he wanted everyone to know the impact that each of you and that CADCA is having on transforming communities across America. He also wanted you to know that you can and you do contribute to global change. Let's watch the video message from Director Yuri Fedotov.
Distinguished guests, ladies and gentlemen, let me start by thanking General Dean, Chairman and CEO of CADCA, for the invitation to address you. I very much regret that I cannot be present with you today, and I wish you all success. Ladies and gentlemen, UNODC's approach to drug use is simple. Drug use and drug dependence are health disorders rooted in personal and environmental vulnerabilities in families, schools, and communities. As such, they require an integrated, comprehensive set of responses that treat drug users with dignity and with respect of their human rights. Such an approach requires the mobilization of a broad range of constituencies to work in partnership. It recognizes three crucial elements. The causes of substance use problems are interrelated with other social and public health problems. Evidence-based measures are ineffective if delivered in a piecemeal or isolated manner. They need to be delivered with a concerted and comprehensive process if they are to make an impact. Effective responses to drug use problems require action that is supported at the local, state, and federal levels. A decade ago, UNODC and WHO embarked on a jointly implemented project entitled the Global Initiative on Primary Prevention of Substance Abuse. The project strategy was to support local partners in Southeast Asia, Eastern Europe, and in Africa to mobilize their communities through the provision of technical advice, contacts, funding in selected cases, and the development and dissemination of good practices. A rough estimate of number of people reached by the activities of our local partners is around 33,000 young persons and 8,000 adults. The project was a welcome example of how, while working at the community level, we must think how partnership and political commitment can be developed at the global level. The 2009 Political Declaration on International Cooperation to Counter the World Drug Problem comes in direct support of this global approach. It advocates mainstreaming community involvement and participation as a main part of the response. Moreover, in the proposed action plan of the Political Declaration, all stakeholders at the community level, including the target population, their families, community members, employees, and local organizations, are involved in drug demand reduction measures. As you can see, the establishment of multi-sector anti-drug coalitions is a community response advocated for on a global scale. Such an approach has successfully been implemented in coordination with CADCA since 1980s. CADCA has gradually evolved to become the leading national organization in the United States addressing substance prevention through empowering community-based coalitions and representing their interests. We at UNODC believe that the work done by CADCA is crucial to help communities to build structures that deliver and support substance use prevention programs and initiatives. Your commendable work in forming coalitions helps build competencies to prevent drug use, but it also makes communities safer and healthier. Through these activities, people can connect, discuss, and assume responsibility for their communities and neighborhoods. By providing such training and by representing the voice of over 5,800 community coalitions, CADCA has helped to provide evidence-based programs to prevent substance use. The empowerment of communities is key to prevention. Service providers, schools, and organizations cannot prevent substance use on their own. Community anti-drug coalitions are, therefore, a great example of how resources and ideas can be combined to have a wider impact. Ladies and gentlemen, I commend you for bringing together so many people interested in community anti-drug coalitions and substance use prevention. The more that people and communities are involved, the more effective our efforts to prevent substance use will be. I look forward to UNODC and CADCA cooperation in the future. I thank you very much.
We hope that you recognize when people say CADCA, they don't just mean the staff at CADCA. They mean each of you. You are CADCA. And so the world's drug czar is complimenting and commending you on all the work that you've done. We hope that you enjoyed those positive and validating words from Mr. Fedotov. CADCA and the UNODC will continue to partner on global drug demand reduction. In fact, we invite each of you to get involved with the UNODC's International Day Against Drug Abuse, which will take place on June 26th. More information to come. We'll post it on our website. We'll send you out communications. So make sure you're connected so you too can be a part of this great experience, which CADCA helped to shape. This year's theme, Global Action for Healthy Communities Without Drugs, really is meant to reinforce the role of the community and community coalitions and the impact you have on addressing drug use abuse. So now, let's move on. We want to get to the moment that you've been waiting for, to hear from our keynote speaker, to round out our opening plenary session, and to send you off for the rest of the week inspired and motivated. We'd like to present Mr. Dr. James Fowler. Based on his best-selling book, Connected, The Surprising Power of Our Social Networks and How They Shape Our Lives, the author and University of California, San Diego professor will describe the results of groundbreaking research that unlocks a revolutionary new understanding of the sway that we have over one another, and through our connections, why we do what we do. I can't wait to hear. And by the way, make sure that you don't forget to get your book and have it signed by Dr. Fowler at the CADCA membership booth in the exhibit hall following his address. Now we present to you Dr. James Fowler.
Good morning. When I tell people that I study social networks, they come to me and they say, you must know a lot about Facebook. As it turns out, the kinds of social networks that we are interested in are actually not just these online social networks. We are interested in social networks that change our lives. We are interested in social networks that are not just the people that we email, not just the people that we, what's going on? Not just the people that we email, not just the people that we are on Twitter with or on Facebook with. I'm interested in these people. I'm interested in your connections between the people that you know here today, your deep, real-world, close social connections. It's these connections that really matter, and it's these connections that really form a basis for how we influence one another. Now, in order for us to really get an idea of how it is that we're connected to one another, it's important, first of all, to think about what you yourself are doing in your own social networks. And in order for me to really give you an idea for how it is that we think about this whenever we're doing the science of social networks, I first need to tell you how we measure them. And the very first thing you have to do whenever you're in this situation is you have to answer a question, what is a friend? So think about that for just a second. How would you define what a friend is? Well, if you were us, what we would do is we would ask you to name someone who you discuss important matters with. We'd ask you to name someone that you spend your free time with. And so I want each of you to actually close your eyes for a minute, and I want you to visualize this. I want you to name, who do you discuss important matters with? Who do you spend your free time with? Okay, so that's not going to be everybody on Facebook, is it? That's going to be about 5 to 10 people. In fact, whenever we talk about this in our book, and whenever we do studies of this across the country, what we usually find is that people name up to 10 people. Whereas on Facebook, we have on average 150 friends. And so these are the deep, close social connections that we have and that we've always had since we were huddled around campfires in the Serengeti. Now, one of the things that I wanted to do today is I wanted to actually show you some network pictures, but the picture's not showing on the main screen. Oh, it's showing on the sides. Ah, very good. OK. That's good. OK, so I was not understanding. OK, so this is a network right here. I'm done. So the reason why I'm showing you this is because you look at the big hairy balls I'm going to show you in just a minute, and usually whenever you look at those figures, what you usually see is these nodes, these circles that are attached to one another with these lines, right? And one of the things that we normally see is that we see that there's this complexity. But really what happens is that you have to think about these networks more as something that's very simple. What you do is you think about two people in this network and one connection. And that connection can be anything. It can be a friend, it can be a neighbor, it can be a coworker, it can be someone who's in CADCA with you. And one of the things that we do is we build up from that basic building block. And so, for example, you have many pairs. So you guys are having conversations with one another, you're making relationships with one another. And one of the things that you're really starting to do is you're starting to communicate in ways that you may not be able to perceive. Because you'll have a conversation with someone, and then they go have a conversation with somebody else. These many pairs in the room are interconnected. And one of the focuses of our research has been not just how we affect the people we can see, it's how we affect the people that we can't see. And that's the reason why it's important to think about these social networks as a whole. Now, the very first research that we did on social networks actually didn't have to do with drug abuse, it had to do with food abuse. We were very interested in this epidemic of obesity because in the United States today, it's really becoming a crisis. And we were interested, when they called it an epidemic, did they mean it literally like spreading from one person to another like the flu? And so we got this great information from this study that's been going on since 1948 called the Framingham Heart Study. And they've been following these individuals in Framingham, Massachusetts ever since then, started following their children in the early 1970s, started following their grandchildren in the early 2000s. And during all that time, in order to keep tabs on everybody, they actually asked them to name a friend. They asked them to name a coworker. They asked them to name all their family members. And so we can actually map these social networks. And in this map, each person is a circle, each relationship is a line, and we can actually make colors here to be able to start to look for patterns. And the colors that we used here were red for people who are normal weight and yellow for people who are obese, people who had a body mass index greater than 30. And one of the things that you can notice right away from this map, where we're trying to put all the people who are closely connected close to one another in the map, is that there are clusters. And in fact, when we started doing the statistics, we found that these clusters were incredibly strong. If your friend is obese, it increases the likelihood that you'll be obese by about 40%. If your friend's friend is obese, it increases the likelihood that you'll be obese by about 20%. And if your friend's friend's friend is obese, it increases the likelihood that you'll be obese by about 10%. So in other words, if I don't know anything about you, but I know something about your friend's friend's friend, then I can do better than chance at predicting something about you. And we thought that this was truly incredible. But this in and of itself is not evidence of influence. It's not evidence that my eating behavior was changing your eating behavior. It's not evidence that my exercise behavior was changing your exercise behavior. there are other things that could be causing this besides influence. So one of the things that might be causing this is this process that sociologists call homophily. It's one of my favorite words. It's a word that literally means love of like. It's the idea that birds of a feather flock together. When two birds are flying together, one bird didn't make the other bird look that way. They chose to be with one another because they are of a similar type. And so some of what we see in this network could be that people like to go to the gym tend to become friends with one another. Or people who like going out to restaurants, they tend to become friends with one another. Another thing that might be causing these relationships that we see in this vast social network is context. It could be that there are changes in the environment that come and go. And so a gym might open up down the street, and just by coincidence, you and your friend both start going to the gym and losing weight, even though you're not going there together and even though you haven't talked about it. And so as it turns out, it's really a very hard problem to figure out how much of what's going on in these networks is actually one person affecting the behavior of another person. But one of the really interesting things that, that we were able to do is we were able to take this great information we had over 30 years and not just have maps, but make a movie. And this, I'm going to put this map into motion now, where what we see is from 1971, we have this amazing change in these social networks where people become friends with one another, they stop becoming friends with one another, and over time, one of the things that you really see whenever you look at this movie, which doesn't appear to be working right now, is that you have a change in the network structure that makes it look like we're not just doing things independently, that we're really part of this greater whole, this superorganism. When we're making these individual decisions, we're affecting others and they are affecting us. Now, after the obesity study, we went on to study other things that are more relevant to your guys' interests today. One of them was smoking behavior. And once again, we found that smoking behavior extended in the network up to 3 degrees of separation. So if I don't know anything about you, but I know that your friend's friend smokes, then I can do better than chance of predicting whether or not you smoke. Just like the obesity study, what we found was that there were these clusters of smokers and clusters of non-smokers. But here we found something that was really extraordinarily different from the obesity study. The network itself was being changed by the behavior. And so what do I mean by that? What I mean is that if you looked in the early 1970s at where the smokers sat in these social networks, they could be in the center of the network or they could be on the periphery. But starting in the 1980s, with our public health campaigns, we noticed a change. Smokers started getting pushed to the outside of their circles. So the social pressure campaigns were making us physically healthier by helping us to stop smoking, but they were making us socially less healthy. They were harming the very people that we wanted to help. And so one of the things that we always talk about with these network studies is that it really shows you all the different things that might happen that are unintended consequences. That whenever we're designing new ways of getting people to live healthily, it's important to use positive methods and to keep people connected, because once they're disconnected, you can't reach them. We also looked at drinking behavior. Drinking behavior, at this point, you probably won't be surprised to find out that if your friend's friend drinks heavily, then you're more likely to drink heavily as well. We found that these clusters extended 3 degrees of separation in the network. At least part of this is due to influence. But one of the interesting things that we found in this particular study was that although men are more likely to drink heavily, women are the ones who actually do the influencing. So when a man stops drinking, the men around him don't care, the women don't care, but when a woman stops drinking heavily, other people pay attention and they change their own behavior. Now, one of the really interesting things about this is you have to wonder about what the right way to do interventions is. Do you target the person who's susceptible to the health harm, to the substance abuse, or do you target the people who are influential? It's possible that you actually want to target the people who are influential because they can have this multiplier effect. If you get one woman to change their behavior, you might get 3 to change their behavior as a result of the one woman changing their behavior. And it's not obvious. If you don't think about how the people that you're trying to reach are connected to one another, this might not be apparent to you. And I think it's really important when you're talking about programs that are focused on drug abuse to have programs like CADCA, Because what this does is this reaches out to influencers and tries to send you back to your communities where you're going to have the strongest person-to-person impact on other people. Now, we've also looked specifically at marijuana. And here we use a different data source. We use this great data source called the National Longitudinal Study of Adolescent Health. And in this study, what we did is we looked at kids. We looked at adolescents, teenagers from the ages of 14 to 18. And remarkably here, we did not find that these behaviors spread up to 3 degrees of separation. Instead, they extend up to 4 degrees of separation. So if your friend's 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 friend is engaged in substance abuse, it increases the likelihood slightly that you'll be engaged in substance abuse as well. And the reason why that's important is because when one person changes their behavior, it can ripple through the network. And in these adolescent networks, it ripples a really long way. One person's actions can have an enormous impact on all the other kids in the school. The other thing that we found in this particular study is we found this relationship between sleep and drug abuse. A lot of times you hear that when you're looking for signs that teenagers involved in drug abuse, one of them is that they aren't sleeping so well. And the conventional wisdom is that it's the drug abuse that's causing the poor sleep. Well, we were actually able to track how sleep behavior spreads through the network and how drug abuse spreads through the network. And what we were able to show in this particular study is that it's actually sleep deprivation that increases the likelihood of drug abuse. And so the reason for that is that whenever you aren't sleeping well, you make more risky decisions. And so one of the things that we were able to show in this is that you don't have to just stop drug abuse by telling people to stop doing drugs. There are other ways that you can get them to live healthy lives, like making sure that they eat right, making sure they exercise right, making sure that they sleep enough. And so attending to general health is one way that you can start these ripples through the network that are going to help to reduce substance abuse. Another thing that we looked at were parents. So parents, as it turns out, don't have that much impact. I'm sorry to say, they have some impact, but they don't have impact in the same way that you think they do. When you're a teenager, your goal in life is to be different from your parents. And so this is one of the very few times in all our other studies we see that there are these positive relationships, that if I start doing something, then my friend will start doing it, and my friend will start doing it, and it'll create these cascades. But when you're a teenager and you're looking at your parent, if your parent starts doing something, they will kind of want to do the opposite. And so it really depresses this effect at exactly the moment when we would like to reach teenagers. But there's good news here. Teenagers are strongly affected by their friends, and as a consequence, they're influenced by their friends' parents. And so whenever you are engaged in trying to create these coalitions in your communities, one of the things that I would encourage you to do is to tell people that positive parenting, when you exercise warmth and you exercise control, that those things have an impact not just on your own children, they do a little bit, but not as much as we would expect, they actually have a big effect on your children's friends. And it can spread through the network just in the same way as these other phenomena that we've seen spread through these networks as well. Now, Nicholas Christakis and I, we're the ones that have been doing a lot of this work, but we've been teaming up with lots of other researchers as well. One of the things that we really wanted to know was, why is it the case that these behaviors spread so much? Why do they spread so far in the network? Why is it the case that one person's actions and behavior can become 2, and then 4, and then 8, and then 16, and so on, and so on, and so on? Well, one of the things that we are built to do as humans is to feel emotions and to show emotions. If you think about it, when you're angry, you don't just feel angry. You actually show it. Other people can tell that you're angry. It's like when you walk down the street and you see someone smile, you can't help but smile back. Now, we tried to explain this to a reporter from the New York Times, and he said, "Oh, we don't do that in New York." But everywhere else, people tend to be in sync with other people's emotions. And it's this emotional contagion that can help to drive the spread of these behaviors, right? You come here, you get inspired, you take that inspiration home. And so one of the things that we wanted to do is we wanted to see, well, do we see the same effects for emotions as we see for behavior? And in fact, that's exactly what we saw. Here's a map where we color the network. The nodes here are yellow for people who are happy, and blue for people who are not happy. Get it? Blue? Okay. And one of the things that we found here is that, once again, we get these clusters that spread out to 3 degrees of separation. So if I don't know anything about you, but I know that your friend's friend's friend is happy, it increases the likelihood that you're happy by just a little bit. And one of the interesting things about emotions is that, contrary to behaviors, they can actually spread between people who don't know each other so well. And so all these other behaviors, the connections that matter are siblings and spouses and close friends. But neighbors didn't have any impact on whether or not you were obese, whether or not you smoked, or whether or not you drank. When it comes to happiness, if your friend becomes happy, it actually increases the likelihood that you'll be happy as well. And so there's something about face-to-face contact that really promotes the spread of emotions that's not so effective for behavior. Behavior is really, everything that we've looked at, it has to be your deep, close social connections in order to be able to change people. And the way you reach a large number of people is through those sequence of those steps from friend to friend to friend, not by just bombarding people that you don't know with information. Now, one of the things that people wanted to know once we've done these studies is that, okay, these are observational studies. These are people sort of doing things in the world. You had no control on the experiment. And so we've started to do controlled experiments in the laboratory. And you can't do a controlled experiment on drug abuse or on obesity, because it just takes too long to see how people's behavior change. You can study the change in attitudes, but those attitudes usually go back to where they were before the experiment started. And so instead, we did an experiment on generosity. And what we did is we had people come in, and we had them play this game where we gave them some money and said, OK, you can leave if you want. Just take the money and run. Or you can give some or all of your money to a group project. That group project is going to make 3 other people that you're playing this game with better off, but it's going to make you worse off. And so the question is, do you do something for yourself, or do you do something for the group? Well, as it turns out, when people give to the group, and when those people then go on to play the game again with a different group of people, then they give more. In fact, every dollar of giving in the first round of this game caused the other 3 people that they were playing with to give an extra 20 cents. When you see someone who's generous, you can't help but adopt their norms. And this spread from person to person to person. In fact, in this experiment, you won't be surprised to find out the effect spread to 3 degrees of separation. And so the second person gave 8 cents more for every dollar. The third person gave 5 cents more for every dollar. And when you total up all of those effects, every extra dollar of giving in this game yielded an additional $3 in giving by everybody else in the network. In other words, the network acts like a matching grant. And it's really, really important to realize that whenever you're doing your own advocacy. You can't see, we're talking about things you can't see, but it happens. If you can see an impact you have on another person, it doesn't stop there. They also have an impact on people. And you have to really think about your own impacts in these ways in order to be able to assess them correctly. Now, I told you that I don't study Facebook, but Facebook is obviously a very, very important topic. Twitter is a very, very important topic. I think I'm getting questions by Twitter as we speak. And one of the things that we want to know is, now that we've studied these real-world face-to-face social networks and seen how truly extraordinarily powerful they can be in people's lives, what happens online? Are we just going to have the same kind of life as we had in real life, or is it going to be something different? Well, in order to answer this question, how we take our natural social networks online, I'm going to bring in a social media expert. Who knows who this is? Alyssa Milano, that's right. So you might know her from Who's the Boss in the 1980s, if you're my age. If you're a little younger, you might know her from Charmed. She's a television actress, and as it turns out, she loves to tweet, and tweeters love her. In fact, she has over 1 million followers on Twitter. So you can imagine, I'm giving you a talk about the power of social networks. You might think, Alyssa Milano is an incredibly powerful person. She has 1 million people following her. Well, as it turns out, she tweeted a link to the Amazon website for the book Connected. And when she did this, Nicholas Christakis and I, we realized, aha, now we have an experiment. We can see whether or not it's deep, close social contacts that matter, or if it's these millions of connections on Twitter that matter. And so we actually looked at our sales and how they went up and down over the course of the time where she tweeted, and see if you can guess where on this graph she tweeted. She tweeted right there. So much for the power of online social networks. Now, this is not science. This is just an anecdote, right? But the idea is that those million connections, they're weak ties. They're not strong ties. I would be surprised if any of those million people are people that Alyssa Milano actually has a deep, close social relationship with. She probably communicates with them in different ways. And while it's true that celebrities can sometimes motivate us to action, so there's good evidence, for example, that Oprah Winfrey motivated people to vote for Barack Obama, most of the time online in these social networks, the network ties are too weak for them to have an effect. And just to give you an idea of why it's so different, this is a network of college students in a dorm, about 100 college students, and their close friendships. And let me show you what that network looks like whenever we put a Facebook network on top of it. It's completely different. The average person on Facebook today has 150 friends. And while it's true that some of those people are deep, close social connections, most of those people are not. And so the question is, how do we figure out who those people are? If we're using social media to reach people with a message, how do we figure out who amongst all those people are the real friends? Well, one of the things that we've turned to is actually photo tagging. Okay, and so how many of you have ever tagged a photo on Facebook? Raise your hand. Okay, so the idea is that you post a photo on Facebook, and you tap on the person's face, and then you type in the person's name. This doesn't happen that often. Think about the people that you tag in your photos. Okay, think about that list I had you make at the beginning of the talk. Do you tag people like that, or do you tag people that you don't know so well? On average, what we find is that people photo tag about 15 people. And this is mostly younger people. There's some people that tag none. But this is actually not a bad way for us to get at the real social networks online. And when we do that, we get a network that looks something much more like this, like the other networks that I've been showing you in these particular studies that we've been talking about today. And here what we did is we asked the question, is it the case that if I'm smiling in my profile picture, is that related to whether or not the people that I'm connected to smiling in their profile picture? And here the yellow clusters are smilers, and the blue clusters are non-smilers. And that's Nicholas. I always have to make fun of him here. He's in the non-smiling group. And here what we find is that these groups extend out to 2 degrees of separation online. So it's not the case that we're all Alyssa Milano and our actions don't matter. They only matter for a very small group of people amongst all those people online. And to the extent they matter for other people, it's because you're the close friend of a close friend. It's not the direct connection that matters. It's the fact that you can motivate your friend to do something, and your friend can motivate their friends to do something. We also did these maps for obesity, because you can code how much people weigh by looking at their photos. And here what we found in these close friend networks on Facebook were clusters of overweight men and clusters of overweight women that extended out to 2 degrees of separation. So in other words, if I don't know anything about you, but I know that your photo friend on Facebook is smiling on the profile picture or a little bit overweight, then I know something a little bit more about you. And so what do we do with all this? One of the ways that people have reacted to our work is to say, well, this is the death of free will. You're telling me that all those other people out there in the world have this impact on me, I might as well give up. Just like this guy, he says, my friends are making me fat. And his wife says, well, like your friend Bud, for example. The idea here is that it's possible to interpret all this evidence as though there's nothing that we can do. And I'm going to tell you today that's the exact opposite of the message I want you to take away from our research on the power of social networks. There are a number of things that we've learned from this study that can impact each of us in our daily lives. First of all, you don't want to be these people. Here's a woman who decides to stop being friends with her longtime friend because she's overweight. And let me tell you, that's a bad idea. Don't dump your friends. We went back to the Framingham Heart Study, and while it's true that when your friend puts on some pounds, it increases the likelihood that you'll put on some pounds, we also looked to see what happened when people stopped being friends with someone who became obese. There were about 1,000 people who kept being friends and about 1,000 people who stopped being friends. And then we looked to see what their risk of obesity was in the future. And guess which group was at higher risk, the dumpers or the keepers? The dumpers. Every friend makes us healthier. Every friend makes us happier. There are 40 years of research. Long before I started working on this, there's 40 years of research that tells us this. And so the last thing that you want to do whenever you find out that your friend is involved in some unhealthy activity is get rid of them. Because getting rid of a friend is very costly to you. And when you're thinking about things in terms of drug abuse, one of the things that it's hard because a lot of times when someone starts doing drugs, it pulls them into a different group of friends, or it changes their culture. It's harder to really connect with them. But let me tell you, you'll be healthier if you try. You'll be healthier if you can keep them in part of your friendship group. Now, I don't want to say this is true for everybody, right? There are some people that go so far in their behavior that it's not a good idea to maintain relationships. I had a woman email me and say, are you telling me that I should get back together with my husband who abused me? And I said, no, that's not what we're talking about. We're talking about these average effects. There are going to be people out there that need professional help, and that they don't need friendship so much as they need a doctor. And so I don't want to say this is true all the time, but if your friend gains a couple pounds, for goodness sake, don't dump them. And that leads me to my second piece of advice from this, and that is you have to get your friends involved. Okay, so Kathy, this cartoon strip from Kathy, actually referred to the obesity study, and they're all sitting around and reading it, and they're very nervous because they're all thinking that they're going to get dumped by the other person. And at the end, they figure out the perfect solution. When the waiter comes over, they point to their friend and say, she'll have a salad and a cup of water. They order for each other rather than getting rid of one another. And this is what's really important. When your friend is involved in drug abuse, the most important thing you can do for them is to maintain the friendship and to try to help them to not do that. Help them to live a healthy lifestyle. Help them to sleep better. Help them to exercise. Help them to do all the things that are consistent with living a healthy life where you're not going to be depressed and you're not going to be motivated to move into an area of drug abuse. Now, the last thing I want to talk about is making good behavior visible. This is a commercial from Liberty Mutual. And one of the things you'll notice here is that these good deeds that people do for one another, they're not returned by the person who got the deed. Someone else saw the good deed being done. And so this man sees that the other man picked him up, and so then he holds the elevator open for this woman, and that man saw that act, and these actions spread from person to person to person. Every single day, we see acts of kindness. And this is one of the things that brings us together as human beings. We are able to connect to these acts of kindness, and it influences us in our own lives to go on and commit these acts of kindness ourselves. And this is where I really want to leave you with the discussion today. This boy had a brilliant idea. You can see he's a budding network scholar. He's got a picture of a network on the board. And his idea, and this is from the movie Pay It Forward, his idea was that all you have to do to make the world a better place is to practice 3 random acts of kindness to individuals and ask them for nothing in return, other than that they do the same. And he realized that the reason why this is so powerful is because of math. It's because of exponential numbers. It's because 3 times 3 times 3 times 3 times 3 becomes a very, very large number very quickly. Each of us has the capacity to influence not just the people we directly see, but the people that we are indirectly connected to through a series of deep, close social relationships. And so one of the things I want each of you to leave with today is to realize your network power. This research, I'm obviously very interested in it as a scientist, but it's been very deeply influential in my personal life. When we did the obesity study, I actually lost 5 pounds, and I kept it off. And the reason why is because I realized, no need to applaud, it's just 5 pounds. But it's something. And the reason why I was able to do it is because I realized that making myself healthier not only affected me, it affected my son, and my son's best friend, and maybe even my son's best friend's mother. We are connected through these social networks to dozens and hundreds of people who we can't see, whose actions change as a consequence of our own actions. And when you're involved in your communities and helping them to end drug abuse, you're not just helping the people you can see, you're helping the whole community, and you're helping the whole social network. And with that, I'd like to thank my social network, and thank you guys for inviting me to come speak to you. Questions at Twitter? That's great. Okay, so we have some questions by Twitter here. This is very high tech. Okay, so this question is, what is the biggest challenge for coalitions in social media? The biggest challenge. You guys are in the trenches, so I'm sure that you know more about the big challenges than I do. I think one of the hard things with social media is using social media to reach the real social network. While it's true that half of all people, all adults, are on Facebook today, the other half aren't. And so if you're going to use social media to reach people, one of the things that you have to do is you have to motivate people not just to spam everybody in their friend list. You have to motivate them to do these targeted messages. You want to tell them, have coffee with somebody, have a real face-to-face conversation. Those are going to be the things that are most powerful. And it's not the case that social media doesn't matter. The Obama administration, one of the reasons why their campaign was so successful was not because the campaign connected directly to individuals who might support them. It's that they connected supporters to each other. And so, for example, myBarackObama.com inspired a record number of coffees to discuss the campaign. And I really think it's that face-to-face action where you're probably going to be most effective. So what you want to do is you want to live in this world where we're using social media to activate real-world social change. So that was question number one. Here's another question. Is one social network more effective than the others? Well, this is a really good question. So I gave you the Twitter example up there a moment ago with Alyssa Milano, and it doesn't appear that she had much of an impact in that case. There are some situations where people on Twitter can motivate action, but it's hard. And the reason why it's hard is this, I'm going to sound like a broken record, but it's these face-to-face relationships that really matter. And that doesn't mean that you have to be face-to-face. One of the things that we found in the Framingham Heart Study was that people who named one another as close friends had just as much impact on each other if they lived next door as if they lived hundreds of miles away. And so you want to activate these close relationships in people, the people that are your next door neighbors, the people that are your friends from school, your friends from work. You want to activate those real world connections. And as a consequence, I think that a network like Facebook actually might be more effective for this. Because on Twitter, it's going to be a lot more of these weak ties, but on Facebook, it's going to be a lot more strong ties. And so I would say that if you're considering a social media strategy for your local organization, your local coalitions, one of the things that you really want to do is you would want to, I think, look more into Facebook than into Twitter. So that's that question. Here's another question. Do social networks also work in reverse? If I stop using drugs, will my friend's friend be more likely to stop using drugs? Yes, and I'm sorry if I didn't make that clear. One of the things that we do in these studies is we look to see when people start the behavior, and we also look to see when they stop the behavior. And the best example we have of this is the smoking study. During the period of that study, smoking in this country went from 40% all the way down to 10%. It's the exact opposite of the obesity epidemic. And so one of the things that we really were able to see in that particular study was that stopping the behavior works very much like starting the behavior. In fact, we couldn't find really a difference in the strength of it in these different ways. And so if you can get one person to stop using drugs, or you can prevent one person from using drugs, I feel like what the evidence tells you is that there's going to be this cascade effect where you're affecting not just one person, but you're affecting many by changing that one person's behavior. I should ask you to raise your hand if you tweeted these, actually. So, is there another one? I think we're good, so.
I think that's it.
Okay.
Join me again in welcoming and thanking Dr. James Fowler. Thank you so much. Thank you for being here. Don't forget, get your copy of Connected and have it autographed in the exhibit hall. We have just a couple of housekeeping tips. One, if you need to check the time or location of your Capitol Hill Day appointments, there is a master list of all confirmed appointments at the information desk near the registration area. There will be territorial and international ribbons for you at registration at the ribbon counter if you did not receive those earlier. And also, the Academy Convocation, the room has been changed. We have quite a few RSVPs, and you will be meeting in Annapolis 1, 2, and 3. Someone has lost a credit card. If it's yours, you may identify it and claim it at CADCA's information booth near registration. We have something new this year. Normally, the reception would have been on last night, Monday night. It's tonight, Tuesday night. The reception, network reception and ideas fair will be in Exhibit Hall E from 4:45 until 6:30. Please be there. We have some great ideas presented at the exhibit hall with the Ideas Fair. And then finally, we had a contest or a drawing for a prize, and we'll be awarding one every day if you booked your reservation and you're staying here at the Gaylord. So let's see, our prize winner for today is Holly Murray. Holly Murray, if you're in the room, you've won $209 gift certificate that can be used for any purposes here at the Gaylord, except for non-alcoholic, I might add. You can pick up your prize at the registration desk. We want to make sure that you go out and get connected. Make a great day.